Joining me now, Tammy Bruce, Dr. Jen Caudle, and Mercedes Slatt. Mercedes, let me start with you because there's a lot of different angles here, of course, and one is the political angle. We see it all today being set up on Capitol Hill. I think the Democrats are setting up the blame game, but by the same token, it's not going to be as easy as repealing and replacing, right? I mean, there are some pitfalls to this.
Well, first of all, I think, Charles, what we're learning is a lesson of bipartisanship and the importance of having bipartisanship. Let's look back when Obama and when Congress passed Obamacare back in 2006, and it was all Democrats who supported Obamacare, no Republicans on board, and so you see the lines have been drawn. And so I think there is going to have to be a phase in terms of replacing Obamacare. First of all, because the Republicans need to get their plan in order. That's one of the biggest problems that we're seeing, is that they have components of these plans. Obviously, we see HHS cabinet nominee Tom Price, who did present a plan at one point, and they could get elements from that, tax credits, for example, also having state exchanges. But at the same time, this is going to it's a complicated process, and it's going to take time, and they're going to have to start dealing with these larger components of dismantling Obamacare through the budget reconciliation process, which would only require a majority vote, not 60 plus.
You know, Tammy wants to jump in here on the political aspect, but let me ask the doc first, okay, the nuts and bolts of this, because I know some apolitical doctors who they're not on either side of the aisle, who have told me it's sort of embedded. You've got 20 million people who are in this thing. If you've lost your doctor, you've lost your doctor. How do we put Humpty Dumpty back together again?
Well, that's a really great question. And as a physician, I mean, I see patients all the time. This is something that we're thinking about a lot. I mean, look, healthcare has changed a lot over the years. That's a fact. And as a primary care doctor, I'm an osteopathic family physician. You know, seeing a patient come into my office that never had insurance before, that had it now, is really inspiring. But there have been lots of problems. And that's what we're talking about, is healthcare moving forward. What do we need? We need a lot of things. I mean, we need to make sure that people have accessible and affordable health care. That's the first thing, and that's probably the biggest thing I know that we need to focus on. All
right, but Tammy, to that point, it would have been more affordable if we had tort reform. It would have been more affordable if we had blurred these state lines and inspired competition. And it might have been more affordable if we didn't let the health insurance companies write the law, and as soon as they weren't getting paid, they skipped out.
That's right. And look, and this is what's wrong with Paul Ryan and Schumer and everyone else, there's no rug to pull out from under anybody. This is like having a car that's a lemon that's on blocks in your front yard, talking about how you'll never be able to take a drive again. This is already dead. The problem is, you might have health insurance. There is no health care. You've got a premium that has gone up, as we know, hundreds of percentage points. You've got deductibles and copays that people also can't afford. People are choosing to not go to the doctor. They're paying for something that they cannot use. Now, there's the people on Medicare, and that's a dynamic that'll have to be dealt with. But as Mercedes mentioned, state risk pools can be established. You've got a dynamic where those two elements you mentioned can be implemented. But the fact of the matter is, to say making America get sick again, what? Sick of paying for something that we can't use because you can't get an appointment, because you can't afford the copay? This is what's going to have to end. Already the American people have suffered. The plan that the Republicans can implement is actually returning health care to the American people. That's not just health insurance, but actual care.
You know, Mercedes, on that note, there's no doubt in my mind that these huge premium increases on the eve of the election played a major role in helping to propel Donald Trump into the White House. We know there are a lot of factors, but this is one that hits home for a lot of people whose wages haven't increased, who were promised they can keep their doctors, who were promised the moon. They were promised lower. The cost curve would bend lower, not to the moon.
I thought it was fascinating that President Obama today said that he took responsibility for not messaging better on Obamacare. This wasn't a messaging problem. This was a policy problem. This was a failure of this policy to really work for Americans. And part of it was that. It was the fact that the Americans lost many Americans lost their doctors. You saw the premiums increase. You saw the fact that taxes rose. You saw more businesses that were hiring part-time and not full-time because of Obamacare. There were many negative effects that happened. This has nothing to do with messaging, and I think that's where the Democrats have gotten stuck instead of pushing forward a policy that would work for Americans.
Doc, so they come to you, someone says, okay, listen, you're a family physician, you understand this. How exactly do we do this? How do we how do we change the tires on this? It may not. It may be just slightly more than a limit on blocks. I mean, it's bumping along, but it's bumping along in a way that makes no one happy. In fact, you know, it's so ironic to hear Chuck Schumer talk about America getting sick again when last year our life expectancy dropped for the first time in decades.
Great point.
So one of the things I want to talk about is I think it's important to talk about both sides. And I said this before. As a doctor, look, there is nothing like seeing a patient come into the office that wasn't able to come before.
Did you have patients, though, who lost their insurance, that could no longer afford your services?
Well, I had patients that lost insurance, were able to get the Affordable Care Act, and were able to come into my office. I also had patients that said the Affordable Care Act insurance was too expensive for them, which is why I say there are two sides to one coin. To answer your question, what we need to do is we need affordable and accessible, and those are not the same thing. But we also need to make sure that that doctor.
Would you be happy to see tort reform, though? I mean, I don't want you to say anything out of school here, but it's been known that doctors have ordered up a whole bunch of tests that are, for the most part, unnecessary to cover the legal basis more than the health issues.
That seems to be actually be a different issue than what we're talking about now. What I'm talking about.
So tort reform wouldn't help this at all?
What I'm talking about is getting patients access to care. You asked me, you said, what do we need to do to change this? We need to make it affordable and accessible. And there are other things we have to remember, too. We have to remember that doctors and patients need to maintain that relationship. We have to build up the doctor workforce. We can't forget that. And we have to make sure that we minimize uncertainty.
There's two things addressing your concerns, absolutely. Before Obamacare, 90% of Americans were happy with their insurance and their access. What we were worried about were the poor and the people on the street, the others who didn't have any access. That's where state risk pools come in. One simple decision could have opened those doors to doctors like this woman, other doctors watching who want to have access, whether you are a guest on Fox News, Fox Business, or if you're working at a local community health clinic. The fact is, everyone was happy. And then it's about how do you get those additional people, doctor, that you want to be able to see. That's the way to do it. This was a move to single payer. It had nothing to do with being successful. We are now going to back ourselves up to actually getting Americans health care again, so you get paid and so that the person having the insurance actually has access to you.
Well, we know it's a huge issue. You know, it's obviously the first line of battle in the new administration versus the old. Ladies, thank you all very much. Appreciate it.